Press the bell icon on YouTube and don't miss another update.
I am Dr. Shishir Bhatnagar. I am from Cloud9 Hospital, Noida. One of the very common things and very embarrassing kind of problem that we usually face, and the parents are really very hesitant even sometimes talking about, is bedwetting. So what exactly is bedwetting? Actually, bedwetting is, in technical terms, called as enuresis. Enuresis is a condition when a child is not able to keep himself or herself dry when we are expecting it to be happening. Now, it's of various types. Most of the time, the enuresis is a very mild phenomena. It's more of a distress attached to it rather than a trouble. What exactly happens is, many a times, the children, how the bladder develops is, over a period of time till the age of about 18 months, the bladder has got an involuntary mechanism of contraction. So once it is filled with the urine, it contracts and releases the urine. So the child does not have much of a voluntary control on the bladder emptying. As the child starts getting bigger, becomes about 2 to 3 years, he has some control, some voluntary control on the bladder, so that he can pass urine as probably he wants. He can indicate, once the pressure is felt in the bladder, that I really want to go to the loo. But the only thing is that many times it may be delayed also. So a 4-year-old child may also not say exactly whenever he is feeling a bladder pressure. It can be under the effect that he is playing around, or he's just not feeling about it. The children has got a very good control over the daytime bladder, especially children between the age of 4 to 5 years. The child can actually hold the urine and can pass the urine once indicated to. By the age of 5 years, most of the children, about 80 to 90% children, are usually having a good control of bladder, especially in the evenings and nights also, when the child sleeps off. About 14% children still have bedwetting more than 5 to 6 years. About 10, by the age of 10 years, 1 to 5% children still have bedwetting, which may be very normal. As people think that there may be many diseases associated with the bladder problems, but there aren't any. There are very few rare conditions wherein the enuresis can be a trouble and can be treated with a drug or some surgical interventions. But most of the time, these are very normal conditions, and over a period of time they get self-corrected. So what are the advisories for children, for the parents who come with the enuresis or the bedwetting? First, a very good history should be taken from the parents. They should be counseled. One should always look into the full criteria of the parents. Now, one should listen to the history of the parents, why they feel that it is a distressful mechanism. So mother would be more distressed about the bed getting wet rather than the child passing a urine in the bed. So that is one thing. So mother has to be counseled for that. This is not a problem. Most of these situations actually are because of the disturbance of the child, actual disturbance between the child and the environment. Environment can be anybody. It can be parents, it can be the peer group, it can be the school, it can be the environment itself. Now, how the parents can be troublesome for the child? Any child who is about 3 years old or 4 years old or even less than that, 2.5, they have a social pressure. People feel very important that the child should be dry now by, say, 2 years or 2.5 years, that the child should be dry completely. But this may not be the case in that particular child. One has to individualize. They always compare with other people, that my relative has a child who is now completely dry by night. These kind of comparisons actually give a kind of a compulsion, and now this compulsion is actually used like a force onto the child, that you are not supposed to be passing the urine. In fact, this is the child who is going to pass more urine in the night because of the brain level compulsion. The children, it's a kind of a disturbance for a small child that he has to be dry. In that process, there is an incoordination between the bladder and the brain mechanism. So that is one thing mother has to, and the parents have to understand, that this is something, it's going to increase the problem. And most important, they should coordinate and should console the child. It's okay, it's fine, it can happen that way. And we should try not to be wet the next day. Even if it happens the next day also, you should try to say again. There are other ways you can give some kind of encouragement to the child in the form of some award, some reward, so that the child feels very comfortable. Yes, see, I am achieving this. Though after the age of 4 years, 5 years, we should start training the child. This is called as bladder training mechanism, wherein the child should be given less of fluids, especially if you can divide your 24 hours into, say, about 40% of the liquids can be given in the daytime, in the morning, in the first half of the day, and about 40% in the second half of the day, and about 20% of the fluids should be given in the later part of the day. Very important thing, we should actually deal with the school also. We should discuss out with the school counselors, the school teacher, about the bedwetting habits, because many a times we have seen that if the child has been shifted to a new school or a new environment, the bedwetting, which the child was dry actually in the night, has started now bedwetting again. This usually actually indicates kind of a imbalance between the child's inner environment and the outside environment. It can be teacher. Many a times we've seen and interpreted that teacher was too harsh on the child and the child started with bedwetting. Or there is the student who is troubling the child, and this distress is reflected into the form of a enuresis. So again, these things should be discussed with the parents, with the teachers, with the peer group, and in fact you should always try to take a good history from the child, what troubles him, and best would be just spend about 1.5 hours with the child discussing how he plays, how he goes, what things he likes, what thing he doesn't like. In these 1.5 hours only, he will tell everything about what he doesn't like, and you will get the answer. So bedwetting should not be interpreted as a disease. It's a condition which is correctable. It can be corrected with very minor, with few minor things.